I saw some people the other day crying, oh, I don't know, Trump has removed money. He said he's not giving us any more money. Watu wanalia. Why are you crying? It's not your government, it's not your country. He has no reason to give you anything. I mean, you don't pay taxes in America. He is appealing to his people. Shauri yenu bana.
Africa is in a panic mode. You know, talk about the president, talk about the NGOs that are working in Africa, talk about, you know, the workers who have been working in this organization. But each and every policy that was touched by the executive order by President Trump has come into realization. And you know, Trump was so much into America first policy, and this has led to you know, stopping granting now the World Health Organization, and he also actually signed an order to, you know, halt the works of USAID, and this has had a very, very big effect, especially in Africa. So how has this then affected lives in Africa? Anyway, before we even get started, thank you very much for tuning in to Africa is Marwa. I mean, if you're coming back for another time, you already know that the conversations around here is to ensure that Africa actually becomes independent and Africa takes ownership of its conversation. If you're coming for the first time, I mean, thank you very much for tuning in, and please don't forget to like this video and share it wide with those that you know value the story about Africa. So, well, it's less than 20 days, I mean, since President Trump actually was sworn in, and we know in his maiden speech, he was actually so clear on the changes that he wanted to make and even the executive order that he wanted to sign. But I really want to touch on the policies or the executive order that really touched on you know, the African continent, and that has really shaken our leaders and the NGOs in Africa. You know, we're talking about people losing their jobs. You know, we're talking about the sudden demise of some support in terms of health sector, in terms of development, in terms of education, in terms of food security that was brought about with this foreign aid that was coming from the United States. I mean, I'm talking about the USAID. And we have all known, this has been trending for a while now, on what's really going on with USAID.
Let's shift our focus now to the deepening agony of thousands of workers of organizations that have been hit hard by the stop work order by the US government, an order that has also left thousands of beneficiaries of critical programs funded by the US government in uncertainty. Many affected non-governmental organizations have been forced to send workers on compulsory unpaid leave, while others have opted to close shop entirely. And as Safin Achengoma reports, health stakeholders are emphasizing the need for domestic health financing to break the dependency on donor funding for critical programs.
Shock and uncertainty has gripped the health sector as the realities of the U.S. funding freezes sinks the stop work order signed by U.S. President Donald Trump on his first day back in office temporarily suspended all U.S. foreign assistance programs for 90 days pending reviews to determine whether they are aligned with his policy goals. A directive that has left many local government and non-governmental organizations that run programs supported by the U.S. cash-strapped and struggling to stay afloat. Kisii County government, for instance, has suspended all U.S.-funded activities and sent over 500 workers home with the January 2025 salaries only. The letter by the county director of public health and sanitation directed the workers to hand over and wait for further guidance.
The magnitude from the health sector, we can say we are feeling it more because these are lives, these are people. But also other sectors, agriculture, research, even youth empowerment. Many of the fellowships which are there to strengthen and build the capacity of many different people is actually affected as we speak.
She insists that the discussion on donor transition plans is pertinent to avoid such knee-jerk disruptions.
When the abrupt decision has been made, we are talking of 1 million plus people living with HIV. We are talking of how many children? So at least the humane way to go about it is to have a conversation with the countries and tell them that in the next 5 years, in the next 3 months, we are going to be changing strategy, we are going to be transiting from your country. How prepared are you?
Considering the shrinking donor funding space, she emphasizes the need for domestic health financing to ensure sustainability.
The silver lining in a sad situation is that it's our wake-up call. It's our wake-up call to ask ourselves, when we have the LM 2019 declaration, why haven't we invested in health as was envisioned in that document by our leaders? When we fund our healthcare more, then we're in more control. If a donor for one reason or another may not honor their commitment, we will not be in a crisis.
The organizations that have been subgranted by USAID are now in a panic mode, and actually many of the employees have been sent to leave. I'm talking about, I want to give a very good example, like in Kenya and the news that have been trending, talk about even drugs or the medicines have not been available in hospitals. The hospitals that had some workers that have been supported by USAID have actually been sent on a compulsory leave, and they're now in a dilemma. They don't know what's going to happen.
To a major setback in the health sector that could reverse gains made in the fight against HIV in the country. The Trump administration in the US on Tuesday moved to halt the supply of life-saving drugs for HIV, malaria and tuberculosis in countries supported by USAID. A memo sent to contractors and partners working with USAID instructed them to stop work immediately as part of a broader freeze on US aid and funding since Trump's inauguration on January 20. Kenya, a major beneficiary, will lose billions of shillings in HIV funding, as Willie Lusige now reports.
So which end are you using to eat?
On Tuesday, Kenyans and Africans woke up to find they had suddenly lost access to life-saving drugs, especially for HIV, as the reality of Trump's re-election began to sink in.
I, Donald John Trump.
A memo sent to contractors and partners working with USAID ordered them to stop supplying HIV drugs and other medical supplies. This signals the end of the life-saving PEPFAR program, a casualty of the new order from Washington. PEPFAR has been crucial in saving lives and preventing millions of HIV infections. In Kenya alone, it funds projects focused in reducing HIV infections and providing inclusive access to treatment, from testing to management and treatment of HIV/AIDS. The President's Emergency Plan for AIDS Relief, PEPFAR, pumped 43 billion shillings from October 2024 to September 2025 in Kenya. The cut in funding, according to stakeholders in the health sector, could disrupt HIV treatment, putting patients at risk of getting sick and spreading the virus. It could also lead to the emergence of drug-resistant strains. While the impact is significant not just for Kenya but for other African countries, the Kenya government has urged citizens to stay calm, stating that in December 2024, Kenya began transitioning to alternative funding sources for HIV management. Health CS Deborah Mulongo Baraza says the government is exploring alternative funding after the US withdrew from WHO and stopped HIV-related aid.
I have tasked the various state departments, the various programs and directors that have been involved or that will be affected by this, so that we can be able to map out and look at the impact.
Speaking in Mombasa, the East African Health Summit, CS Mulongo affirmed that the government is mapping out areas most affected by Trump's executive order, urging that Africa must build resilient health systems.
This will come up with a concrete way forward in terms of interventions.
USAID and Kenya have worked together since 2003 under the PEPFAR program, providing HIV testing kits, medicines, and medical supplies. The partnership has helped prevent approximately 270,000 HIV-related deaths and 26 million other globally.
The government itself is in a panic mode. They don't know what's going to come next, and how is this now going to, going to affect the projects that they had initially with USAID. But aside all that, this is another wake-up call, when you look at it as africaismarwa or as anyone who values Africa, this is another point where we now need to wake up as Africa. As President Uhuru said, and I will actually put a short clip of him speaking just recently, asking the citizens, especially for Kenya, why are you crying?
I saw some people the other day crying, oh, I don't know, Trump has removed money. He said he's not giving us any more money. Watu wanalia. Why are you crying? It's not your government, it's not your country. He has no reason to give you anything. I mean, you don't pay taxes in America. He is appealing to his people. Shauri yenu bana. This is a wake-up call for you to say, okay, what are we going to do to help ourselves? Instead of crying, tujiulize, what are we going to do? Haya ametoa hiyo pesa, sasa tutafanya namna gani jameni? What are we going to do? Yeah? To support ourselves. Because nobody is going to continue holding out a hand there to give you. It is time for us to use our resources for the right things. We are the ones who are using them for the wrong things.
Why are you crying, Africa? Why are you in a panic mood, Africa? I mean, we have all the resources that it takes, to actually make sure that we realize the potential of Africa. But what are we doing with these resources? Where do these resources end up to? I mean, we have leaders, yes, and they have budgets. They have big budgets that they always create after every financial year. But where does the money go? We're talking about in terms of development. We're still waiting for the American people to support us. We're still waiting for the American people to support our education. We're still waiting for the American people to support our health sector. And yet we're not paying taxes in America. We're paying taxes in our respective African countries. So this is a wake-up call. It's a wake-up call for Africa to ensure that they actually, as citizens, we need to keep our leaders accountable to each and every policies that they come up with, and each and every tax that they collect. How are they utilizing it up to the end? And that is why many people have been excited about, the Gen Z movement in Kenya, talk about how they have been trying to keep the government accountable, because we no longer have oppositions in Africa. We realize that each and every election there are the losing side and the winning side. But after we're done with the elections, they join hands, and then they start formulating policies that don't favor the citizens, that don't favor Africa. So this is up to us now. And this is why I feel like, yes, I know it's a bad in a way, having that, and in terms of even the health sector, talking about even drugs not being available for HIV and AIDS. And, these are patients who really rely on these drugs. So it's going to be having a very big or adverse effect to an extent. But it will really take much pain for us to realize the potential that we have as Africa. And this is why we really support President Trump's coming up with, with the American first policy. We also need to come up with the Africa first policy, in that when they want to come for our resources, we need to ask ourselves, what are we getting as Africa? And why do they need to even take our resources at first place? Don't we know how to utilize our resources? So we need to, our leaders need to actually come up with this conversation, because I know we have so much brilliant minds in Africa. Talk about people like Ibrahim Traore, who are trying to ensure that this kind of conversation actually, grows or magnify across the African region. And we know it's going to happen. This is just the start. I mean, it's going to be painful, and very sorry for those who have lost their jobs, and very sorry for those organizations that were really doing a very good cause to support, people in Africa. I understand USAID has had some of the some of the policies or some of the, accountability issues that have made maybe Donald Trump to, do away with it. And I think in his maiden speech, he started by, talking about there are only two genders, male and female. But, for USA, they only, they had their gender issues or their gender agenda, if I can say. So I don't know what really happened, but we're really waiting to see how this is going to come out in future, because I know they said 3 months, so let's wait and see if USAID is going to continue supporting Africa or not. But Africa, wake up. It's time to wake up. So anyway, thank you very much for tuning into Africa is Marwa. I really appreciate your time. I mean, especially if you're coming back for another time. You're very special to Africa is Marwa, and we really appreciate that you're loving the conversations around Africa. And we hope that we can actually continue subscribing so that we can reach a higher number in the African continent, and that we can make a bigger difference and take the lead in this conversation. So if you're coming for the first time, thank you very much. I really appreciate it. Don't forget to subscribe, to hit on that notification button so that anytime we do a video, you're actually able to get it at first. Anyway, we come to the end and Africa is Marwa closes. See you next time. Cheers.